we just called this meeting to order. Welcome, everyone. And welcome to Karen and Ann on Zoom. We're glad we have the opportunity to meet you all face-to-face, Zoom to Zoom. And we just go around quickly and introduce ourselves. And also we would like to invite the members of the audience and also people on Zoom to just invite themselves. This is the largest audience we've had. Just mention your name and if you live in Archuleta, and just very quickly, or wherever you live, and you're on Zoom, and if you're affiliated with San Juan Basin, please introduce yourself so we know who's here. That's great. So as I said, my name is Moja Bruce. I chair this committee. This is a work session with two board members of San Juan Basin Public Health, Board of Directors. I guess Ann is the chair and you're the vice chair, correct?
Correct.
And you live in Archuleta County.
I live in Augusta Springs.
Augusta Springs. Okay, please. I introduced you before.
Oh, okay. I'll look at it again. Karen Daniels, and I have lived in Augusta Springs for 14 years and have done a lot of different things while I've lived here. I'm retired now. I have served on the San Juan Basin Public Health Board of Directors since 2010 and have seen a lot of changes and growth and ups and downs, and I'm happy to be here. Thank you. LaVonda Bass.
And what brings you to the table?
Oh, I'm a member of the Investigative Health Board.
Thank you.
And we wanted to speak with someone.
Thank you. And you live here for those.
Yeah, Archuleta County. I live outside the city. So nearby.
Okay, great. Please.
I'm Mary Beth Snyder. I am the secretary of this health investigation. And I've been in Archuleta County for 13 months now. So I'm maybe.
And I'm Leslie Davis, and I live here, and I've been here about 18 years. I worked at San Juan Basin Health in my earlier career as an RN or public health nurse. So I'm pretty interested in the community and services here. And I am the co-chair of the committee here, so.
I'm Susie Cliffner. I live here in Augusta Springs and have been here for almost as old as I am. Long time. I worked for San Juan Basin Health also from 92 to 2012.
Okay.
As an RN. And I was a nurse manager for the last 10 years, I would say.
Okay. Well, I'll just also give up my credentials. I'm a master's of public health and nutrition. I'm also a registered dietitian. Can you? I don't know how much we can raise our voice. I'm also of my terminal doctorate degree in evaluation, measurement, and research, and I chair this committee. I'm a resident of Archuleta County. So, Ann, go for it. Please introduce yourself.
Hi, I'm Ann. Did you ask to speak to me because it echoed a little bit?
Yes, I asked for you to please introduce yourself and what brings you to the Board of Health, and perhaps you, Plata or Archuleta. Just a little bit about yourself.
So my name is Ann Ruiz. I'm the current chair of public health. I actually rotate off in November this year. I rotate off the board. I work at Augusta Springs Medical Center. I have for 7 years. I'm the chief administrative officer. I do the legal work also for Augusta Springs Medical Center. So I do a lot of the things that you would see that are not clinical, the compliance, quality programs that are required by the state, HR and medical staff issues, those sorts of things. So that's my day in and day out role. And then with public health, that's a passion that I've had. I used to, and prior time, do legal work for public health. I do not do that at all. I have not for the last 7 years. But so that's my involvement. And we're here because you all had questions. And so Karen and I are here to answer. There's one other person that is on today that would be available to give support to Karen and myself. Karen and I both feel like we know a lot The staff has been very educational to the Public Health Board. They have taught us a lot of things about the programs. It's nothing that I think to the level that people who used to work inside the department would know, although obviously there's lots of changes over time. But Leanne Jalon, who's the executive director, you've seen her turn her screen on, is also available. Karen and I will do our best to answer questions, and she'll steer us to correct information if we've provided something to you that's inaccurate.
Wonderful. Thank you so much, Anne. Leanne, we probably have heard you present the budget report 3 times in the last month. So, but if you want to introduce yourself to others, please go ahead.
Sorry, this is Leanne. I wasn't sure if you're talking to me or Anne, because I guess our names now sound the same. So Leanne Jalon, Director of San Juan Basin Public Health, here to provide some background information. Anne and Karen are going to cover the board processes and the way that the board makes these decisions and votes on them, and the information that the staff provides so that the board can make appropriate decisions. We've also had a few other staff members join today who do not intend to speak, but they are curious what the questions and needs about their programs and areas of responsibility are, so that they have asked if they could, and these public meetings, so they have chosen to log on to hear what the concerns are. So thanks for having us.
Wonderful. Thank you so much for making yourselves available. I think it would behoove us to just have members of the audience. There's a large group who's here, just to introduce themselves and just mention if they live in Archuleta County, and also the people on Zoom, if you could just take yourself off video if you're able to, and just share your name and what brings, just where do you live, just for us to know, and then we'll just get started, just to be inclusive, so that the community has a chance to meet not only this group, this committee, the investigative committee that's at work, and also the San Juan Basin Public Health District Board that has served our community for a number of years. So I'll start with members of the community. Could you please just mention your name, where you live? And
Dwight Philhauer and my wife Marcia, we're residents here at Pagosa Springs.
Thank you so much.
Jenny Blage, Pagosa Springs.
Thank you.
Rhonda Sledge, Pagosa. Shailene Zarate, Pagosa.
Wonderful.
Dale Schmidt, my wife Ellen, Pagosa Springs.
Great. Nice to have you.
Betty Lee, Archuleta County.
Wonderful.
My name is Gunnar Burkamp. I also live here in Pagosa Springs.
Okay. And gentlemen?
Roger Sanchez. I also live here in Pagosa.
Okay, wonderful. And anybody on video? I'm not sure if the people on video on Zoom actually heard the names of the members of our audience. I won't remember everyone's names, so welcome. Glad you're here. Anyone that's on Zoom, would you please just introduce yourselves?
Yes, Pamela and Michael Costin. We live in Pagosa Springs, and we love what the San Juan Basin Health Department has been doing. Thank you.
Thank you.
Hi, I'm Parse in Plata County. I'm working at San Juan Basin Public Health, just calling as the general public to listen in.
Kalisha, what do you do at San Juan Basin Public Health in La Plata?
I'm a division director.
For which division?
The Prevention and Population Health Division.
Thank you.
Yes, thank you.
Hi, I'm Jody Scarpa. I work with the Pagosa Springs Medical Center. I've worked here, I've lived in Archuleta County since 2009. I love our community and a fangirl of San Juan Basin Public Health. I'm very interested in this issue.
Hi, my name is Janet Wolf. I'm also with San Juan Basin Public Health. I'm in their Policy and Partnerships office, and I'm also clerk to the board, and I live in La Plata County.
Janet, did you say you're on the board?
I am clerk to the board.
Oh, clerk to the board. Somehow I missed the word clerk. Thank you, because I didn't see your name on the list. So I said I missed something.
Nope.
Thank you. Anybody else? Welcome.
Hi, I'm Rosalind Penny. I'm with San Juan Basin Public Health. I'm the Director of Communicable Disease Prevention, Investigation, and Control Division. And I live in neither La Plata nor Archuleta, sort of near the border though.
Which border?
I am just south of Ignacio, very close to both counties.
Wonderful. Thank you. Welcome.
Hi, I'm Adrian Mizunian. I'm the Director of Public Health Innovation at San Juan Basin Public Health. I oversee the Assessment and Planning Division, as well as the Chronic Disease Injury Prevention and Behavioral Health Promotion Division.
Hi, Adrian. Thanks for being here.
Good afternoon, my name is Ann Camp. I'm a La Plata County resident and I work for San Juan Basin Public Health as the Human Resources Director.
Thanks, Ann. Anybody else? Okay. Well, welcome to Terry and Clayton. We know you're here with the Pagosa Sun, so thanks for joining us. And there's somebody else's number I cannot recognize. But anyways, welcome, and we're going to get this meeting started. Thank you so much to San Juan Basin Public Health in coming, not only the Board of Directors, members of the Board of Directors, but also the staff. All along, I think this investigation committee, by its word, it intends to learn about the health district's work in our county and to be able to understand how our community is being served. We recognize just up front that the way the structure of the district is, it serves 70,000 people, 56 in La Plata and 14 in Archuleta. And it does not necessarily look at individuals by county residents or their budgeting or their work or their programming. They look at the entire district. In some cases, you are tracking by county, such as your COVID results, but in many cases, you do service, and in some of your reporting, you do say how many were served in Archuleta. We were able to dig and find those. So we reached out to you early on to be able to engage you in understanding those services, your structure. I think we've spent quite a bit of time on our own, and you've provided us with some documents, and we've read through them, and Leslie has continued to go deep into those documents, and we came back and we've reviewed them together and tried to answer some questions. I personally have attended all 3 budget meetings that Leanne did, and it's, I basically, by the end of the 3rd one, Leanne, I feel like I know the information pretty well. It's the same information, so it was good. I heard it 3 times. If I didn't get it the first time, I heard it right 3rd time.
Better be careful, she's going to call on you to present it.
No problem. I know that 80% of the budget goes to human resources, and that's not unusual because human service organizations, that's the case. So I heard that too. Anyways, so we're here. Some members of our committee are still grappling with questions. And we did not come with a set of questions that we were going to ask, but allow the members of the committee to ask you questions. And it seems like we were initially thinking we're meeting just with those Ann and Karen, but now that we have others to support answers, this makes all our time efficient, so you don't have to go back and research. So I'm going to invite the different members of our committee to just speak loud and ask your question, please. And then I'm going to let San Juan Basin Public Health board members, staff, choose to answer whoever is ready to answer that question. Again, thank you for being here, and we're glad that we have this opportunity to learn alongside with you about the services in our county. Who would like to go first? Yes, please, Susie. Okay. And please speak loud so they can all hear you.
Okay. As part of this committee, we've been given the task of determining if the citizens of Archuleta County are receiving the essential public health services from San Juan Basin Public Health. It's been really difficult to get the information from your website, but we've looked at it. I've gone down and asked questions at the health department here without getting too much information either. So my questions to you are, who can I talk to find out what direct services are being provided by San Juan Basin Public Health at the Archuleta County office? I know WIC is, I know immunizations are. What else?
Did you all hear that question?
So I guess I could start at kind of the big picture, and I think if you've seen the presentation many times, you've seen the presentation that talks about the statutory core services that are provided. And I know you were with San Juan Basin Health, you indicated, and some of those statutory services changed in about 2009, which I know led to a lot of internal changes. And then there's an org chart in there that also talks about things. So as I understand it, here's kind of a big picture, and I'll talk through first kind of the big picture. There's prevention and population health program, and within that, there's all sorts of things that are offered within that. There's health insurance literacy, and Kalisha is on the line here, but these are her programs ultimately, but that about 8% of the clients for health insurance literacy are served in Archuleta County. And that often helps people get signed up for the ACA and those sorts of things. Open enrollment, I think, is coming up soon. A second program that's under there is Maternal Child Health. That is a program that is with a private practice in town, the Pagosa Springs Medical Group. That's not the medical center, but that particular group, that is a collaboration with public health. There is the regional oral health care that's provided. It's provided in both counties. It's actually, I think, provided in a 5-county region, and about 13% of the persons served in those 5 counties are in Archuleta County. There's the WIC program that you'd be familiar with, Women, Infants, and Children. There's staff present on site for that Monday through Thursday. So if you went down and talked to staff, you probably saw those staff. 30% of all the clients served are in Archuleta County for that particular program. There's Nurse Family Partnership that's within that program, or in that, it's a program that's within that. In Nurse Family Partnership, 30% of the clients served are in Archuleta County. There's State of Care Colorado. There's a nonprofit coalition that is involved with Archuleta County there. I might need some more help on that one, but we can talk about that one in a minute. So that if I were to capture that's one arm in terms of services. Then, as you know, there's I'm looking at this list: communicable diseases, prevention, investigation, and control. So, kind of as a big picture, if Archuleta County has 20% of the population that's served in the district, about a third of the investigations occur in Archuleta County. About 50 to 75% of the animal bites actually occur in Archuleta County for the district. I would say statistically 30 to 35% of the communicable disease investigation occurs in Archuleta County. Immunizations occur under this program. Immunizations that happen in the Archuleta County office twice a month. There is not, I don't believe, and Leanne can fill in once I'm done, a waiting list for any service, actually any service, but I do believe travel vaccinations are, for most of Southwest Colorado, only happen in the Plata County office. I think there's people that travel from all over for the travel vaccinations. It's not just Archuleta County that will travel. In terms of sexual health, that's also under communicable diseases. About 20% of sexual health and cancer prevention clinics are in Archuleta County. Obviously, COVID falls under here.
Wait a minute, can I ask a question there with the sexual health? Who is that, you're not doing those clinics in the contracted out to somebody?
I can take that question, and just because I know it's a little bit, there's a mix of services. So we do sexually transmitted infection screenings in our office. During the pandemic, due to the healthcare workforce shortage, we were cutting of funding to this program. due to the statewide and federal reshuffling of funds for pandemic, we were very concerned that we would not have the service available to the needs that we had identified in our community. There was a higher need for this program in Archuleta County than Plata County due to the ACA. So we worked with a provider in Archuleta County to move services to that provider. We made that in both counties. It was something that we had to do due to pandemic, due to workforce shortages, to ensure no interruption in services. We're very proud that this transition happened smoothly for the family planning side. We retained the sexually transmitted infection screening side and retained the cancer screenings. We do those at a slightly less interval of frequency because we're not also doing the family planning, but we are in process of setting up this really awesome program because we do want students to have excellent access to family planning. So we want kind of a no wrong door. If you still come to our office, we want to be able to do telehealth with you, with the provider, as soon as possible to make sure if you need a family planning need right at that moment, we can get your need met. So that meeting was happening today. So no interruption of services, great access for everybody for family planning, and absolutely a change in providers due to workforce shortage in the pandemic.
So that happens in this office here? Today?
What? Yes.
That happened in this office here today?
What?
The telehealth thing you were just talking about.
Today was one of the meetings to get that set up to get it started. So we're in, so yeah, I'm sorry, Susie, I can't hear super well. I think maybe you guys are not, maybe yell into the mic. But we don't have telehealth set up right now, but we did have one of the meetings and I didn't get the feedback on what happened at the meeting, but we're super excited about this because if we can walk in telehealth, then we're meeting all of our family planning needs a block away from the high school. It's awesome.
Yeah, good.
Okay, so the last thing that I guess I could talk about under the communicable disease arm, which everyone would know would be the COVID outbreak support. And COVID shows up in a couple areas of services that are provided. And I can speak to this being at Augusta Springs Medical Center, but about 25% of the outreach that was done for infection prevention was done in Archuleta County. I know, for instance, at Augusta Springs Medical Center, and this is more under the emergency management arm, but there are, I think right now, 4 times a week that COVID testing is done on site at Augusta Springs Medical Center. It's a drive-through outside. That's not Augusta Springs Medical Center that's doing that. That's San Juan Basin Health doing it at Augusta Springs Medical Center site. Okay, so third arm of services that are provided in Archuleta County are environmental health. I mean, kind of as a big picture, environmental health is water quality, air quality, food safety, or consumer protection, I guess we call it. There are different jurisdictions who are involved, and you would probably know that from your past history there, where in some circumstances, San Juan Basin Health has jurisdiction, in some circumstances the county does, in some circumstances the state does. So there's different services that are provided. 25% of the field staff, which are the investigators, are in Archuleta County. And then, so with that, I think you're aware this particular program, water quality, includes the on-site wastewater program, the septic tank review, the investigation.
And can I just, so when you say 25%, is that 1 out of 4?
The investigation staff, I'm not exactly sure how many it is, but I believe that would be 1 out of 4. I think that's one.
Because there's only 5 people here and 1 is listed as environmental health specialist 1. So that means you have a staff of 4, so 1 out of 4. Okay, thank you.
Okay.
We do have another position open for environmental health. It's called Environmental Health Specialist 1. We have had some difficulty recruiting and filling positions in quite frankly, across public health right now. There are labor shortages in all disciplines related to public health, but we've specifically had higher barriers to recruiting residents from Archuleta County. So we do have an additional, and then we'll have I think a 40-60 split.
So I think, Leanne, it would behoove us at some point to discuss what your outreach efforts are around recruitment of capacity in Archuleta County. Like what ways do you try to find people to fill some of those positions? Because I looked online and there were 5 positions filled, and if there was an option of a 5th, 6th position, it would be great to show that on where the staff is too, so that we could pass the word around for those of us who are looking at those websites. But potentially, it would be great to find out how you're actually outreaching and informing our community members of opportunities like that, because work is limited in Archuleta County.
Well, we'll have Ann Camp, our HR, send you the links, and if you guys can help distribute them, that would be awesome.
Yeah, that's one way. We can talk about other ways. Go ahead, Ann, please.
Okay. So on-site wastewater, I can give you from stats, 30% of on-site inspections were in Archuleta County, 33% of the permits issued were in Archuleta County. The water lab is only in La Plata County. There is not a water lab in Archuleta County, but it's also an entire I think it's 5-county region. It's the only water lab around is in Durango. Air quality, San Juan Basin Health does have a grant that they have used for mitigation of radon, and I think, so here I have a stat that since 2018, San Juan Basin Health has distributed 229 free radon test kits in Archuleta County. So consumer protection is another program that's under the environmental health arm, and that's food safety, as you know. So since 2018, 22% of the retail food inspections occur in Archuleta County, 24% of the retail food licenses granted are in Archuleta County. I think you know that the licensing for retail food is set by the state legislature. It is a little bit complicated in both, I think in both counties, but Leanne can correct me, when you have that kind of influx that comes in with tourism and the funding for it comes by population, you know, I think it becomes a complicated thing, but more than the population difference, I would say, our retail food inspections occur in Archuleta County. So the 4th arm would be the emergency preparedness and response. The leader of this program is Lori Zazzaro. She lives in Bayfield. I've actually had to go to her house because of some things dealing with the COVID emergency response. She splits her time pretty evenly between Archuleta County and La Plata County. She is a certified emergency manager, which is pretty unique to have available to the public. She works closely, not just with the medical center, she works closely with the private medical practices in the community and Pine Ridge and Beehive in order to assure that there is an emergency response to this pandemic that meets this community. She has continued on with other programs. I know that, for instance, she held a community-wide, right before COVID, I feel like, she held a community-wide tabletop event that involved the county, the town, the school district, all sorts of folks for emergency preparedness, and that was held at the hospital. She's recently done a burn victim tabletop event, so she's continued on with, or I would say, and Leanne can speak better to this, and I understand this from my day-to-day job, people are trying to learn how to respond to the pandemic and move forward with what they had lined up to do before it hit. And that's a real challenge. So, communications and marketing would be more of a capability that we have than a program. But I did get some stats on this, and I think it's worth mentioning. I can say I know the Sun is on here. They do a terrific job of covering public health, and public health works very hard with the Sun as well. They have weekly meetings to discuss the happenings of public health. In terms of media hits, I can give you some comparison numbers here. In 2021, there were 101 media hits for Archuleta County compared to 205 in La Plata County. There are 223 media hits in 2020 in Archuleta County and 473 in La Plata. And in 2019, 115 media hits compared to 282. So they've run anywhere from about a third of the total media hits to 50%. There is a group then that also, this is not a program, but a functional capability, and Leanne always explains this in the budget, how certain groups cross through and support every program. So it's worth mentioning assessment and planning. They work in all the programming, and they've done a great job at pursuing grant funding. And if you look at the budget and you look at the grant funding that is available to San Juan Basin Health, that particular group has pursued most of it, and it's been available in both counties. They've been very successful. They also provide child fatality review, which that's unfortunately available to wherever that occurs. There's a lot of collaboration that is occurring with local groups, and you're hearing that today. For instance, I think one thing that Karen and I are both familiar with is the suicide prevention that is in collaboration with the Archuleta County community and works with veteran resources. So that's an example. There is a separate suicide prevention program that came with state funding that is not available in Archuleta County, and we knew this last month as a board when we passed it, and it's only available in La Plata County because it was only available through the state based on the statistics of need. There were only a few counties in the state that qualified for it, and it was due to the unfortunate statistics. So there are other kind of, I think I hit the programs for you, and you asked about the programs. So I don't know if you have detail that you want to know that comes from that.
And Susie, it sounds like some of the challenges you've had have been trying to get information from.
Oh, this was good.
Yeah. Okay. And so, just listening to this too, I think there's some ways we could do better. But I don't know. So when you have you gone down to the office down on 8th, and how were you greeted? Did you get what you were looking for, or was that?
Yes, I mean, they answered my questions, yes.
Okay.
I have a question regarding the WIC program, Monday through Thursday. Of what hours? I mean, I drive by that building probably 4 days a week, and I don't see cars there, and it looks abandoned.
It's all being done on.
When are people there?
They're not seeing clients, are they?
I think that there was a period of time during the pandemic when they weren't. I'll let Leanne speak to this. I believe that most of the staff began working with people again in June. If there's something I don't understand about the WIC program, Leanne, you can jump in. But normally their hours are 8 to 4:30, Monday through Thursday. But during I know you said, Mary Beth, that you've lived here 16 months or thereabouts. So basically through the pandemic, there was a significant period of time in which staff all worked in remote situations. So Leanne, I guess if there's something specific I should know about WIC, but I think they probably started back in the office or moved in June.
No, so WIC is one of the interesting programs because it's a federally run program. It has a waiver that's as long as the feds are in a declared emergency, then WIC is prohibited from doing in person, especially because the children that are seen in WIC are not eligible for vaccine. And there is a variety of uptake in pregnant women for vaccine. So interestingly, and this is really hard to keep track of all of this. So WIC is one of the programs that cannot come back in person due to a federal directive. We do have staff, so I think as Ann said, 30% or more than 30% of our agency-wide clients for WIC are in Archuleta County, yet Archuleta County is only 20% of the population. It means that we are serving the clients through a process that the feds have, how should I say it, directed and coached to states, and states have directed and coached local agencies. This is how WIC will be delivered during the pandemic. It's not perfect, but we also understand that when we get funding and directives from other sources, we do follow them. Now, the other part of that is that the office is open 4 days a week. It closes every day for an hour for lunch. The hours are 8 to 4. And that is just due to the constraints of some of the, we've had some, I think, constraints and challenges as all businesses have had during this pandemic about how we're delivering services and who's available. We do offer services in Archuleta County in total 5 or 6 days a week, depending on the service, but WIC is not one that's currently in person.
So Leanne, I just want to make sure that, because when you say 30%, that's, statistically, you're dealing, that's 1 out of 3 staff, right? Because you've got.
Okay, so our WIC staff, more than 30% of the clients reside in Archuleta County.
Oh, the clients, okay.
The staff is in the building.
Is one.
Monday through Thursday, but she is not, clients are not coming in to see her. She is doing I probably didn't describe this well.
No, that's
so
fine.
30% of the clients live in Archuleta County. Right. They come in. They do she's in the building working, but the families are not coming in because federals are prohibiting that right now.
I think we understood that, Leanne. That's not the question. The question is that it was on the 30%. So you're saying that 30% of WIC population across the district live in Archuleta County?
Yes, yes.
And does that suggest, can I finish the question? Does that suggest a stronger need in terms of populations that are in need of such services in a community?
Yes.
Okay, so that is directly related to a population that is affected by income status and health conditions. Therefore, you have a higher population than the 20% that you would expect based on a budget, correct?
Absolutely, yes.
Okay, I just wanted to clarify that because the numbers get.
And so WIC is an interesting program because WIC doesn't have 100% uptake rate. So usually in communities, somewhere between 40 and 50% of eligible families will sign up for WIC. And so the variation that we're seeing would have to do with child poverty rates compared from county to county. So Archuleta County does have a higher child poverty rate than Plata County. Both counties have a similar uptake or penetration rate in the WIC program, and then it results in more families proportionally using WIC services in Archuleta County. We are very happy to deliver this service, even if it's disproportionate, because we think that nutrition for children 0 to 5 and for pregnant mothers is super important. And we do not put any restrictions on the number of families served. We are always trying to increase the uptake rate, increase the penetration rate, and then increase the staffing commensurately. So with that, if there was increased demand, we would meet that demand, and we always have. We never have a waiting list for this program.
Right, so how much is San Juan Basin Public Health put in terms of their funds into the WIC program, and how much of it is coming from the federal funds?
That would be one of our board packet. It would be in the board packet when we renewed the contract. We would have that figure. We generally try with state and federal funded programs to use the state and federal funding rather than use the local dollars, because there are some statutory obligations we have that do not have any state and federal funding. So we use the local dollars for those programs instead.
So I guess back to my question, I think that the reason you're able to expand on WIC population based on the need is because you're getting federal funding to provide those services. Isn't that correct?
Yes.
Okay.
One of the things that I came away from when I went down and talked at the office here was that the WIC person only works 3 days a week for WIC. That's what she told me. So, I don't know.
So there are multiple questions going around. One has to do with personnel that are here present in Archuleta County, which is what Susie's trying to get at. And I don't think we're talking about during COVID. We're talking pre-COVID. And in terms of staffing. So WIC sounds like, from, if I may summarize, that they have enough resources, human resources in Archuleta County to meet the needs of the population that has been identified in needing those services.
If there's not a waiting list, I'd say that's right.
Right. And if there is a need to expand, they have access to resources through the federal funding to expand that program. Correct?
Yes, and we would load balance across the counties. If we had an increased need in one county more than the other, we've often had staff going back and forth, to cover some kind of load balancing that we need, whether it's staff lack of availability or increased need. And currently the WIC staff does work. She works 4 days a week in this manner that we described, which is an odd way to work when you're going to the office, but the clients are not coming in unless they have to pick up the press pump. Then they come in. It's totally convoluted.
And then Leanne, are there specific programs in Archuleta County that's being offered that are directly coming out of San Juan Basin Public Health's budget and no funding from state or federal?
And so this is a question for Archuleta County or for the district in general?
Archuleta County. The 5 staff that are here, are there any of them that are being directly funded by San Juan Basin Public Health's budget and with no funding support from the federal or the state contracts?
I think some of our no, there's nothing that would be funded 100% by local funding. I don't believe so, outside of the COVID response and some communicable disease needs. We do have positions in La Plata County that are funded entirely locally because La Plata County has asked for these programs or services to be available in La Plata County and is paying for them, and then they are restricted. So that is an option. That is absolutely an option in Archuleta County if it was consistent with the overall mission and programming of the organization, and the local community said we want to do X and we will pay for it with Y, then we would hire. And we do that in a couple examples in La Plata County with local funding because we meet with the commissioners frequently. And they occasionally make these requests either as commissioners or through other departments.
Thank you so much for that clarification. Leslie, can we go to you?
I guess I would like to ask a little bit more about the history of what's happened with San Juan Basin Health. Maybe start with that because things have changed in public health. I understand that as far as the services provided, the amount of staff it takes, we're talking a lot of numbers and percentages and everything, but trying to come down on the public's viewpoint of San Juan Basin Health, like not seeing people at the office and trying to understand what services and costs have gone up and lots of changes have taken place over the years. And I know there's reasons for it, but I think there's been a real lack of communication for people in the public to know what services we have here in Archuleta County. I suppose there's a reason for that. there's just, I want people to feel like there's just not a number or statistics. I want them to know that if they walk into the health department, they have people there and services that they need to access to meet their needs. And a lot of times when people come in, somebody needs to be there to kind of triage, you know, this person is high risk mental health, suicide ideation, or but they walk in for some other reason. I mean, and it takes some really qualified people to identify the needs of people when they do come in. And so if you can kind of get the drift of what I'm saying, I mean, the needs are still here, but the programs have changed for some reason, the funding has changed. Of course, there's more and more money that's asked of the county to be a part of the district. And I think there needs to be some explanation of why the changes took place, why services kind of faded away, and now people are wanting them to come back. The county commissioners are struggling with the same kind of questions. They asked in 2020 for some feedback on the cost of septic tanks being put in, the septic systems and the environmental stuff. There's a lot of people that are complaining about the cost of that. Why did it go from, you know, like 100 or 200 up to over 1,000, all in one big jump? I think that people are just not getting answers, and there's really no contact person over here that can answer those pretty important questions to our public. And yeah, there's been newspaper articles and things like that, and things on the TV, but it's kind of impersonal, and I just really feel strongly about the public needing to know what the history is and why these changes came about, so that we can move forward and either continue to be a part of the district or look at what our options are so that we can meet the needs of the public.
Okay, so I guess I'll speak a little to this, and Karen can as well. Many of the things you're talking about, I think the biggest changes occurred, as you know, with the legislative change in 2008 that was implemented in 2009, and this had already worked as a collaboration between Archuleta County and Plata County prior to that, but in 2009, both county commissioners recommitted to the change in statutes and to work as a district. And at that time, the core services were changed. And so that provided some change in direction for how public health, what services it delivered. I do know that and so there's always been a county commissioner since that time. There's been a county commissioner from each county on the board continuously, and they are part of selecting the remainder of the board members that are serving on the public health board. In 2010 and 2011, and I think you know at about that point there was a change in leadership. That's not Leanne, that was a prior person before Leanne. There was an assessment of how the broad amount of services that were provided, and that San Juan Basin Health did not have a sustainable financial model at that time. And that is very much what that had to do with. The reserves at that time were very low. There was very little ability for staffing to be maintained if there had been any kind of issue. And a lot of that had to do with, and I'm stretching back memory a decade, but a lot of that had to do with the matching funds that would be required from local dollars or other sources, and that they realized that programs were not sustainable at that pace. So they looked at the core services, the board did at that time, and certain programs were cut for sure, because they did not feel they could sustain them and stay financially healthy. The hope was that the direct delivery of services in many areas that were done by public health would be picked up by other local providers in either county. So at that time, there were employees you know, in 2011 and 12. And since that time, I would say that I'm not aware of a circumstance in which people came back forward through their county commissioner or to the board directly saying this service is sorely lacking in this community for this reason. Could you please evaluate it with the budget? So from a standpoint of history, how some services were cut, it had to do with the requirements of the state and what could be afforded to be provided at a sustainable rate. I'm sorry that that is still not clear to people in the community. I think, again, I think when I try to cover information that comes out, I do think the Sun provides great coverage to what happens at public health. All of these things are discussed at public health board meetings. And again, a county commissioner is on those to bring back those, to kind of bring back forward what comes in from the county side that's being a request and what's not. So that's one issue you brought up about history. You brought up the issue of on-site wastewater. So with respect to the regulations, I think you know that the regulations that are adopted right now are the regulations that the state put forward a couple of years ago. There were numerous hearings in Archuleta County. I know I attended many of them, Archuleta County and Plata County, that these are the regulations coming from the state. In addition, there were some opt-in features that they were set by the state. You could select certain opt-in features. The opt-in features that the Board of Health, that the board voted for were the ones that a majority of Coloradans are subject to, that had to do with the safety of water quality. In terms of the cost of most things for all of us, and I'm pretty sure you could look at the value of your house 10 years ago and the value of your house today, I think that the cost of staff, the cost of operating is extremely different than it was 10 years ago. And it is hard to pay people a living wage in Archuleta County right now so that they can afford housing. It really is. It's, I can say from the hospital's point of view, and I'm sure it's true from public health's point of view, sometimes, you know, as you know from being a nurse, you have a specialized skill, and it's very hard to attract people in with such specialized skills when they look at the cost of living in Archuleta County. And it's caused everyone to raise pay, and then therefore the cost of things are more expensive. And the same would be true for environmental health. Those people have advanced degrees, and I guess, Leanna, if there's anything else that goes to the cost of those things, you could add in, but I believe a lot of it has to do with personnel.
When we're required by law to set the fee based on the cost to deliver the program, and Archuleta County, I think this was, I think we, in the summary, and I'm sure in the proportional budget request that we make to the commissioners, we're running more than a third of the septic permits in Archuleta County versus Plata County, and the expense, because the county is rather spread out, a lot of the building is happening outside of the town center. So there is tremendous cost in visiting those properties, which is by law has to be recouped in the permit fee. So that is how the board approached that. I also wanted to go back to, I think Annie gave great history and great summary of some of the shifts in programs as to how that happened at a legislative level when the state created a Public Health Act in 2008, and the commissioners joined in a forming resolution to recreate the health district to comply with the new Public Health Act. But the other, I think, driver in the changes in services, we don't have to go back that far in history in Archuleta County to remember when we had far fewer providers in the county. So it's in all of our memories here that there was a time where we did not have choices and access to multiple providers. So now we have Pagosa Springs Medical Center, we have Pagosa Medical Group, we have Access Healthcare Services with a physical presence, we have additional providers. So this is a really good thing from a public health perspective, because our job is to do more of the policy and coordinating work to ensure kind of comprehensive, robust community health rather than the clinical services, if the clinical services are delivered elsewhere. And so Archuleta County has experienced sea change in the last 2 decades, I'd say, in access to healthcare. So that is why, if we continue to do some of those clinical services, what we really do is interfere with the patient's ability to establish a medical home. So the best practice in medicine is that you have a provider that meets your comprehensive needs rather than have fractured care where you're seeing this provider for this and that provider for that, and then there's not a good tie-in for all of your medical needs. So absolutely a best practice is a medical home. That wouldn't have been possible not too many years ago in Pagosa. It is now possible, so we back out of those services and also to not compete with private entities that are also employed in your community.
So Leanne, have you actually conducted a study to answer that question? I mean, I think that there are people that may be falling through the gap, through the cracks on that. And I think just seeing the population, you mentioned we have higher child poverty rates here. And
yeah, we do have that information, yes.
And what, can you describe the sample that you used in that study, please?
We have, what we have is we have the primary care, we have the Robert Woods Johnson Foundation information about numbers of individuals in a community with primary care availability. Archuleta County is not a healthcare shortage community based on availability of primary care per capita. So it is not eligible as a county for additional resources.
So you're using a formula, like how many, what's the size of the population to how many healthcare providers are there, correct?
And so that is what dictates what services become available to us through state and federal resources, yes.
So how do we then determine that people are actually getting access to resources? We have a percentage of people with no insurance. We have people that we talked about that don't have livable wage in this community. How do we make sure that they have access to care and services? And are they actually being served by these medical providers that live in Archuleta County?
We work with the providers, so we are in communication and working with Pagosa Springs Medical Center, with Pagosa Medical Group, with Access Healthcare, which is safety net care in multiple circumstances where we are sharing information and evaluating needs of the community collectively. So we are in, and we have our team that works on assessment and planning is tasked with tracking that. We do believe that there is a higher uninsured rate in Archuleta County than surrounding counties. So that is something that we work on to improve pay source access so that more people can access healthcare.
Right, and just checking to see some services, the insurance companies, it's very challenging here because they're high out-of-pocket pay and people are not getting some of the allied healthcare services, and they may skip some primary care because there's a lot there, high deductibles, and so it's a really bigger question, I think, that we all have to look at as those of us who work in the health field. I mean, I'm not asking for you all to answer that question, but really truly looking to see what the need is in real ways and genuine and authentic, because the numbers just don't tell the story. So I think as part of this process, I really invite us all to look at this more deeply.
We couldn't agree more. I think you're absolutely onto something, and this is something that we need. The way that we can do this in sort of a feedback loop is through care coordination, which is our team is not the medical providers, but they can coordinate care or patient navigators to navigate the healthcare system, because there are all of the challenges and barriers that you were describing. When I spoke earlier about how there are some positions, La Plata County chooses to pay for a care coordination position for a specific population. That would be something that local dollars could go into. We are looking to fill some of those holes. Right now, we have a tremendous responsibility to the community to get through this disease containment with the COVID crisis that is absolutely interfering with other steady state programs in public health. But there are some disparities where La Plata County has additional care coordination because it's paid for out of the county, and that's something that we could look at. But that's different from replicating the medical home, because replicating that actually works us backwards rather than forwards, which is getting people access to health care in the appropriate setting rather than band-aiding that with a different setting. So I hope that that's helpful. This is a very, very long conversation. I would love to, unpack it in more detail another time, but we could spend hours on it. But we could not agree more. We need, as a country and as a state and as local communities, to have better insurance. I don't mean insurance, healthcare, pay source, better assurance that people are able to access the care that they need. That's the word I'm looking for.
Well, and I think too that with doing away with the clinics and a lot of the localized, that building, represented so much in the community. And always had a full parking lot. And now people are seeing what are we actually getting for, the county commissioners are paid every year for services. So we just want to make sure that if there's any of those studies that need to be done, or we have a need in the community that's not being met, we have to open up some communication, and we haven't had that. And I would highly recommend that we develop some way that we can start communicating more of our needs and listening to the public. If they feel like they don't know, or they want to know more about what's going on with San Juan Basin Health, there should be a pathway other than just media to get their questions answered and their care given. So I think because of the change in public health, like y'all have said over the years, the public is not understanding that maybe, if I'm a person wanting to go for some care, would I go into the health department here and then would I get referrals to all of the contracted people you have here in the community? Or am I going to get turned away and say, well, we don't provide that here? So there's just a lot of questions that
we take calls every single day over the phone or at our front desk where we offer the services that we have in-house, and we refer community members to services that individuals are looking for that are not provided in-house. So we have a very robust referral system. Our staff is up to date on the services that are available in the community. There are differences between communities, among communities. There are differences in time periods, right, where something is available and then it's not available for a variety of reasons. So our staff stays up to date and is able to give this information to people in real time. And it is something that we are very much able to do and track. And our assessment and planning team is always sort of scanning for where the needs are so that we can work collaboratively to solve for whatever is being identified as a gap in service in the community. There are differences. Yeah.
Excuse me. In your assessment of our community, what are you finding that are the needs of Archuleta County? Because I really feel like your focus is La Plata County, and I would like to see more input about Archuleta County and what the actual needs are there. What are people calling and asking for?
So I'll jump in and say a couple of things about that. And what you just asked about, the referral data for, Leanne can respond to whether or not that's maintained. But, every 5 years, and this is one of those changes in the law, there has to be a community needs assessment. And in 2018, and I think it was in some of the material we gave you, the public health assessment, the public health improvement plan identified basically 3 goals, and then it had like 3 high priority issues that came from feedback, and then 3 kind of secondary needs that came beyond that. I know that the surveys for that, for instance, the healthcare providers, the direct healthcare providers in Archuleta County, now including the medical center, had stacks of those surveys available. We tried to hand them to every person that came in so that they could write down needs. They were talked about in public meetings. They were available to do online. And then that data was gathered that informed on the public health assessment and how to focus the improvement plan. And so we're in year 3 of that. And Leanne, you can jump in, but I believe, data collection for that would probably either begin in 2022 or 2023, it seems to me, since the last plan was 2018. And I know that a lot of effort was made to try and get that plan out to people. And like I said, I worked at a location where we handed it out to anyone that would take it.
I have a follow-up question, just kind of building on Leslie's question. So as you conducted the assessment back in 2018, what were the 3 top emergent needs that Archuleta County identified from your respondents?
So we identified them across the jurisdiction.
And we did have Archuleta County's responses. We did before we put it all together as a district, right? My recollection is we did, because I remember there were a number of behavioral health oriented things.
Right. So, and that's what I was going to say is behavioral health pinged as the top need in both communities. So what we did is we had a statistically valid sampling for both communities. So we ensured, and the reason that Pagosa Springs Medical Center was pushing for the responses so significantly is because we could not close out the survey until we had statistically valid sampling from both counties that represented the full 20/80 split, as well as we had determined that we would not close it out till we had statistically valid English speakers and Spanish speakers. And so the largest issues that were identified by the community were in the behavioral health realm. And then there's a lot of subsets of behavioral health. So public health is not a behavioral health treatment provider. We work upstream in behavioral health and the prevention arm of that. And what we're working on is risk and protective factors to lessen risk factors and increase protective factors across the community to prevent behavioral health needs rather than treat behavioral health needs. There is another organization in the community that is tasked with behavioral health treatment in the safety net provider realm. So we work closely with that organization.
So Leanne, for the sake of our community, because we have lay public here, could you kind of give some examples of behavioral health?
So behavioral health is both your mental health and substance abuse disorder. So together, those are what we consider behavioral health needs. So mental health is, do you have mental health barriers to full participation in life? And then substance use disorder is part of that discussion.
So none of the chronic non-communicable diseases emerged as a need, diabetes, hypertension?
Those were not identified. So this is the issue with when you do a community survey, right? And this is why we refer back to so in the case of providers per capita, I refer back to Robert Woods Johnson. For other types of things like burden of chronic disease or burden of unintentional injury, or I think those would be the 2. We would refer back to statistics on it because our community members are less likely to identify in surveys some of those types of needs.
But sounds like your sample did your sample go out into the neighborhoods of Aspen Springs and Arvillus?
Yes. Yes, and we did paper and we walked around in neighborhoods where we could walk around with iPads. We had iPads at meetings, so both, and also, I mean, yes, we do go out into neighborhoods. We also recognize that many individuals that go out into neighborhoods come into community for services. So we made things available both on paper and with iPads at many community events. And so we do try to make it as accessible as possible. We didn't close it until it was statistically valid. I will say that there's this really interesting detail, which is often what you hear back from the community can be different from what you are, the two things that are going to be the top two killers in every community are going to be heart disease and cancer. When you survey your community, people are less likely to talk about heart disease and cancer and more likely to talk about things that are current in their life, like a complex issue around behavioral health, right? So we balance it between the stats that we have and the information that we gather, and then we try to bring it all together. In the state of Colorado, there's not a tremendous amount of public health funding for non-federally funded programs. So earlier we were talking about WIC. It's a federal program. It comes into the state, it comes to us exactly the way the feds envision. There's not a lot of state money for interesting, innovative, new things that are emerging in communities. So if you do your public health improvement plan and you say, my community absolutely has identified the most important thing we want to work on is, and let's just use an example, suicide for veterans, right? It's a horrific issue. Everybody wrote it in their survey, and we write it down in our public health improvement plan. It doesn't mean that there is any money that's magically made available for suicide for veterans. Then when the state legislature starts to get pockets of money and send it out, if they decide, oh, we're really interested in teen pregnancy right now, sometimes what they'll do is they'll look at your public health improvement plan and say, well, you picked suicide for veterans, so we have this tiny pot of teen pregnancy money, we're gonna give it to the communities that have identified teen pregnancy. So what we work very hard to do is collect the data, use it to drive the decisions for the community, but not put ourselves into a place where should money become available in the next 5 years, we're not eligible for that money. So we write our goals very broad-based around emerging needs in the community. So if the legislature accesses additional money, we can be in line for that money. Super complex, probably way more information than you all wanted, but there is this art to the public health improvement plan that you take the information available, you survey your community, and then we write some broad goals so that we can never have to turn around a dollar that's available.
Right, so you're trying to be fiscally responsible to access all the resources you have.
Yes, yeah, and it's very hard. Before COVID, people didn't know what public health did, so it was really, really hard to wave the flag, we need some money for this program.
Okay, thank you so much. So can we just go to, maybe we can come back again. Can we give voice to somebody else? Or
Yeah,
you want to just
I just have one follow-up.
Okay, go ahead.
I would like to know what your feelings are about the needs of Archuleta County at this point. It's been 2018 since the assessment was done, so I just wonder at this point, with a new budget coming out and what we're getting ready to pay for our services and be a part of the district, what can you share with us?
My dog was whining, so I went on mute. So we have been dealing for 20 months with a once in 100-year pandemic event, which has really laid to bear some health issues across communities that are very different than what people had expected 2 years ago when they went into their public health improvement planning cycles. So I believe that our most important thing is to integrate what we've learned in this pandemic about what the vulnerabilities in community are, so that we have safety nets in place, whether it's communicable disease or chronic disease, that interferes with individuals or communities accessing their best health. So what this looks like then in kind of day-to-day terms is, due to pandemic, we learned that if people had to stay home from work, we didn't have good safety nets in place. If people couldn't pay their mortgage or pay their rent or pay for food, we didn't have the appropriate safety nets in place. We learned that when we're isolated and we don't have an opportunity to commune with others, whether it's in the workplace, at schools, or in our normal activities, it exacerbates some of our mental health and perhaps our behavioral health needs. So I believe that our next steps as organizations is to address those types of things that we've learned. So it's the communicable disease has revealed that systems need to be bolstered so that when the system is stressed, whether it's the school system, the workplace system, the economic system, individuals' health does not suffer unnecessarily. What that's specifically translated for in many communities is mental health, substance abuse. It's also, unfortunately, in our communities translated into increased prices of housing and some resetting of the labor market where what people can make in their jobs don't adequately pay for all of the things that you need in your life for a healthy life, including healthy food, medication, those sorts of things. So broad-based, that's what I think the next steps of our organization are. We cannot get to that until the pandemic is behind us.
Anything specific though to Archuleta County?
And maybe give me an example of what
Well,
do you
we just had a 47-year-old vet commit suicide this week. And his family, they're all in need. I'm thinking of teen pregnancy. What are we doing about it? A lot of education is needed in all the areas, and I don't know that that's happening because we don't have the staff here. We don't have, which is another question I have, is do you have nurses here that if you have a troubled teen, can go in and talk to them, or parents, or some guidance there? There's just not a whole lot of hands-on, one-on-one, not texting people or tell them this or that. I'm talking about getting in front of people with a qualified person, whether it's a nurse, mental health people, which is another area where we've lost mental health providers here. I think there's been 3 or 4 of the counselors that I know that are very upset because the state cut their funding, and what do we do, you know? There's a lot of needs here, and I'm just real interested in what y'all can do, or, you know, even if it costs us more money to be a part of the district to get those things going here, and maybe bring back some of the programs that we had, I think that's a good area to explore.
Well, I think that would be something that would have to be brought to the board and explored at that level, because it would be a change from where we've been for the last 10 years, which is you're talking about delivering care, personal health care, rather than the public health model that's being followed right now. And in part that happened when there were those changes that I talked about earlier in 2012, where, and this is not true for every program, and Leanne, you can jump in if I'm misstating something, but the delivery of care, I mean, back in 2012, there was not access, did not own the building and the deliverers of care there. Augusta Springs Medical Center at that time did not deliver behavioral health at that time. And so some of these things have changed in the way delivery occurs. Public health is delivering less care in certain areas and getting people that access to care in other ways. But Leanna, if I misstated that with respect to
Before Leanne steps in, and I just wanted to follow up with you. So we do have people in the community potentially that, although these services are available through some of these other organizations in this community, because perhaps they don't know about those services, perhaps it's possible that their out-of-pocket expense is high, they may not even go to access those resources. And I think there's a concern about, you know, I totally appreciate this public health model because it emerged out of nobody was really interested in funding public health services. So they had to be creative and try to be fiscally responsible and come up with a model of care coordinating resources so that they can get the most out of it. But on the ground, at the community level, I think the people are potentially not able to access resources because of the cost associated, especially in a county where people are lacking opportunities for being able to have funds. So I think those are real for our community members, and I think those are deeper questions and whether the board needs to think about and or whether the community needs to think about. But I think I keep hearing Leslie ask the same question. We had our 5th meeting last night, and it's the same questions over. Where are the on-the-ground services for our community members? Who is that on? I mean, I understand all the big global stuff, but I think at the end of the day, you know, Leslie's asking the question is, how do we meet people's needs without being just a resource and referral service or have a document online? You have something to say, Karen?
You know, I would like to comment, in the 10 years plus that I've served on the board, I have been the most consistent advocate for Archuleta County. I have worked with 6 different commissioners during the whole time, you know, each commissioner who is on that board as well, representing their county. You know, a lot of it too takes, it's a two-way communication. And it's a two-way communication. And Archuleta County has not really come forward with what their needs are. And I think your committee and I think this whole action is so excellent, because what it is showing me, especially, is we are not doing enough to communicate to the people of Archuleta County and let them know what's here. I mean, I think you all are surprised at the number of services that are available, but it is, but they're not visible. They're not visible, and we are not communicating well enough. But we need it from the community as well. You know, in all the years I've attended meetings after meetings, and we always, before COVID, we tried to have at least one meetings quarterly in Pagosa Springs, and even still they weren't attended. And we don't hear from everybody, and I think that is, I don't know that it's anyone's fault. I think it's just part of the process that has happened, and just everybody's taking for granted that the services are there, and you're right, we're not informing, but we're not being informed either. So
well, I think that's one of the things we were wanting to do, is ask y'all how can we help?
Sure.
It's not that serious of problems, how can we fix
exactly
if we can identify what our needs are, how can we fix that so everybody's happy and the public knows? And I think the public don't. Like you said, a lot of the public don't know the questions to ask.
They don't.
You don't know what you don't know.
Exactly.
I'm sorry, let's go to Merida. Thank you so much.
I appreciate you saying that, because like in what I've investigated so far, I could see that Archuleta County hasn't been a participant in all this. And just like the way nurses operate, it doesn't really matter how we got to the sickness we're in, it really doesn't matter. This is where we are and what are we gonna do. So it's good to hear from you that we're right. It was a two-way communication disorder. I'm curious.
She diagnosed it.
Yeah, there we go. I'm curious if people don't come into the clinic between 8 and 4 Monday through Thursday, what is the person working on? What are they doing? I don't understand. It could be my ignorance, but what are they
You
doing?
mean like how does she serve a WIC client, which I think Leanne started to go down that road once and then we kind of cut her off. But if you can explain how, let's start with that first.
Okay, so WIC is 8 to 4, nothing else is.
No,
I
everything
thought you
is.
said the office was open, but people can't go there, so then what are we doing in the office?
No,
Okay.
everybody, people can go there. No, so the office is open, people can go there, all of the services, every single service that Anne went through, that's in all of our board packets, that's on our websites, all of those services happen, actually 6 days a week. No. All of those services happen every day, up to 6 days a week. We were getting some specific questions around WIC. WIC is happening in the office, but because of the federal requirements, the WIC staff are meeting with clients remotely. That's why the parking lot looks less busy, because our WIC staff is seeing as many clients, but they are seeing them remotely as required by federal law currently, unless the person's coming in to pick up a breast pump or there's 1 or 2 other things that they are allowed to do in person. So that's what that staff does in person. There's other staff working in person on birth certificates, death certificates. There's staff working in person on care coordination. There's staff working in person on environmental health inspections. There's staff working in person on communicable disease. Any of the services that we've described is happening in that building currently. We are, due to some pandemics, some of the programs restrict who comes in and out of the building.
So if I needed a food inspection for my restaurant, which I don't have a restaurant, I would go down to the Department of Public Health down here. Would I have to make a phone call to make an appointment to talk to the environmental health specialist?
No, you can call and get connected with an environmental health specialist, but luckily for you, if you owned a restaurant, you wouldn't have to come to us. We would come to you, and that our staff does do that 6 days a week.
Okay, so then you have a list of all the restaurants in Archuleta County, and you track you go and do your inspections based on some kind of a, timeline that they're due for the next inspection, correct?
It's actually a risk-based formula. It's not purely timeline. Different types of restaurants have different levels of risk, and prior inspections also indicate future risk.
Okay.
But yes, essentially it's a timeline with some variation.
And so your other staff there is a communicable disease specialist. Do you end up having to call and make an appointment with her, or you go in and seek her out and she's there from 8 to 4?
Most infectious disease investigations are handled over the phone. They're not handled in person anywhere prior pandemic or during pandemic, because communicable diseases are often infectious. And so that's work that we do remotely in all cases. We do, the one time that changes is when someone is in a tuberculosis treatment, then our staff is required and does in the background meet with people to ensure direct observation therapy and taking your TB drugs.
So technically, the only person that you come in to see is INES, is the WIC person. Everybody else will have, right? Is that
If you come in for an immunization,
who does
in the
that?
office, sexual transmitted infection screenings are in the office.
And so, but you don't have a staff here, does someone come from La Plata here for that?
They are over multiple days a week, and I don't have the schedule in my brain.
Right.
But the staff is in the building at regular intervals.
Right.
And if you call, you get an appointment during those regular intervals. Yes.
So I guess what I wanted to do is to draw a picture to answer the questions team here, our team member's question. That to go in and get a service is primarily for WIC, or when you have your staff come from La Plata for some of the other services. So these 5 people that are in there, they're not the providers of all the services. Is that correct?
They would not be the provider. I mean, environmental staff, if you make an appointment because you need a consult to open your new restaurant, they would meet with you in person. If you needed a consult for getting your septic permit approved, they would meet with you in person, so that staff is in the building and available to meet with you. They're not all available at walk-in, but that's not the case. We don't have staff available for walk-in at either one of our buildings for some of this work, because you want to get connected with the right expert that's going to be able to answer your questions, so it's by appointment.
Right.
So am I answering your question?
Yeah, I
Okay,
think
let me say,
what I'm trying to get at is because there's a concern there are no cars in the parking lot, and I'm trying to get an understanding is what specific services are offered from 8 to 4, Monday through Friday there, and which of those services are by phone, which one of them are in person or appointment. That's what I was just trying to do.
I want to make a first clarification point, because the staff, so there's a sophisticated phone system, so if you call and ask to talk to someone in a particular area, you could immediately be talking to someone in Plata County and not realize it's seamless. The services that are available are provided by people who may live in Bayfield. There's about 16 employees who live in Bayfield who could easily make their way to Archuleta County. But the staff also has a regular rotation in which other staff that live in Plata County have a regular rotation in which they're on site in Archuleta County. So a lot of services that are provided are, I guess I think about some of the things that happen at San Juan Basin Health. If you think about the person who, for instance, I'm thinking of Adrian right now, who applies for grants and seeks out money that supports all of these programs, it wouldn't matter where he is, right, in his efforts to be applying for grants. So I think a little bit comes back to where you're talking about direct delivery of care. If you're talking about the direct delivery of healthcare, I think there is a different model than there was 10 years ago. Yeah.
So I was just trying to say, when I look at the staff directory, most people can just look at that and say, oh, there's 5 people in here. We're just trying to also see what are the services along with these 5 staff and what you just explained it. You know, we have these services offered in Archuleta County from 8 to 4. Our staff don't all live there. 5 of them are in Archuleta County. The others come from Bayfield. The others come from La Plata. And so that you, at the end of the day, you can walk away and saying these are the services that are offered with these resources locally and from outside. Capturing that somewhere, I think, is what our group has been trying to get a handle on. Is that correct?
Right, and what I specifically would like to know is the RN time in Archuleta County.
Yeah, so that was gonna be one of my.
Perhaps you could research that and get that back to us. She wants to know how many hours is an RN time here in Archuleta County.
and do you want to know that in relation to RN time in La Plata County, or to make sure that it's an 80-20 split, or I'm just curious.
I'm more interested in what the services you're providing and if it really requires an RN or not, because it doesn't sound like it to me. It's mostly
no, very few of the services that we provide.
There's no more clinics. There's no more clinics that RNs get?
Very few of the services we provide require an RN. That is true.
Is that in La Plata also?
That is across the state of Colorado in public health.
Okay. That really helps me understand a lot, because a lot of the services that you're providing are just referring people out.
They're coordinating.
Coordinating with the hospital, access care, the Ghost Medical group. So when people come in and they're asking for services, they're not really gonna get anything right there. They are referred out to other people that we're contracted with. Is that right?
Well, and I guess I think of changes that have occurred in many areas, but yes, there's the coordination of care. And when you were in public health, you're probably familiar with things that Health and Human Services did, which was trying to get people who may have may qualify for help get signed up. But public health, since the passing of the Affordable Care Act, is actually pretty integral in getting people signed up for that insurance, so that they can have access to care. And whatever you may feel about that, there is an effort that's made there. I guess I've lost Leanne.
And so the Health and Human Services, I was reading that they're really a key part in your coordinating, like maternal child health, the environmental. There's just a lot of services that go through. Is that correct?
I think that's true. And then when Leanne mentioned, and she is back. I believe the care coordinator that La Plata County wanted to hire specifically for things. I think that person is actually an RN with Health and Human Services in La Plata County. Am I remembering that correctly?
That is correct, yes. So that is one of our only, that might be our only full-time nurse.
And it's a Health and Human Services
In all
person.
of San Juan Basin Public Health, and the person is
What
paid,
RN?
yes, paid out of a budget, especially from La Plata commissioners.
Right. Right, all of our other nursing staff, well, I guess.
They've changed their model, they had to, across the country,
Wow.
everybody's changed their model. Okay, I think we got the picture. You have any more questions?
I do, I only got
Good.
one.
Okay, go ahead.
It seems to me like we kind of came to a conclusion that you are not keeping the records of your entity in how much money and time and services are provided in the county separately. It appears to me that we can't get information about what specifically happens in Archuleta County, and even today we still haven't. The question continues to come up. Is that just the way you keep your books? You just don't worry about how many nursing hours or how many hours are spent in Archuleta County and how many shots you gave and how
I'm
many?
gonna jump in on that one because as a board, we have concerned ourselves greatly with the budget. And so we, as a board, every month, if you look through the packets, particularly in the consent agenda, we approve every program and we've asked for detail about where the money is to fund the program. So we have staff has to track the budget because they receive federal money. They have to track it by October 1 to September 30th every year. Because they receive state money, they have to track it by July 1 to June 30th every year. And because they receive money from 2 counties, they have to track it by January 1 to December 1 every year. But they track what we receive as a board is how the program is tracked. So how the money is spent in the program, and the program is distributed district-wide generally. There are one-offs, and we had one last month, I know, in our consent agenda, and this is one I've already alluded to, where there was state money available only for a county that qualified by the number of suicides in that county. So then there it has to be tracked differently yet again, but we have never, I realize that you all are asking for that, but we have never as a board had a request. And we as a board have never asked them, not one member on our board has ever asked them to track it by the way you're suggesting. I understand the importance of what you're raising. We, including county commissioners, have never asked for that kind of breakout. It is very complicated. I think anyone who's been in public health knows why. In this state, public health can be offered in many different ways. You're all investigating that. And you would see that some counties have decided to keep it as a department of the county. Some have made it a separate district, but just run it as one county as a separate district. Some have done what we've done and have multi-county districts. But one of the reasons why I would say it's likely not to be handled as a department of the county, or why that's not as common, is county work is already complicated, but the funding for public health through the application of federal contracts and applying for state contracts is not a simple process. So I would say to you, yes, you're right. We have never tracked it that way. We have, until now, never had a request to track it that way.
I thought in 2014 and before 2014, it was tracked that way, and then suddenly, starting in 2014, it wasn't. So you can't tell me how many shots you gave in Archuleta County in a year. That just seems kind of weird to me that you wouldn't know that.
I believe you could provide, but when you say how was Archuleta County's contribution of funds spent in a program compared to La Plata County's contribution of funds, we've never tracked the tracking of funds exactly as you're talking about. There is in the budget, there is a document that talks about how much state funding supports the program versus local funding, but it's in by program, right? So, Leanne, were you gonna say something?
I guess I'm talking
No, I was
about
gonna say that when
services.
the summary that Anne gave in the beginning, that's a summary from things that are reported in board reports and in the proportional funding request to counties. So again, this is all in the packet of information that we provided, and Anne kind of ran through it and summarized it in the beginning of this, in the introduction in the beginning. It said things like, 30% of WIC clients are in this county versus 70%, and this many restaurant inspections versus that many restaurant inspections. So we can do it by activity, and in fact, we provide it to the commissioners by activity every year. We have never been asked to do that in any other forum. So, and in fact, we're not asked by the Archuleta County Commissioners to do that. We're asked by the La Plata County Commissioners to do that. We meet with them twice monthly and have for years, and so they have asked us when we turn in our budget request that is by statute due on September 1st every year for the next calendar year, that we give, because we're serving the multi-county district, they ask us to parse out some proportional funding of services, and then they ask us to note which services we're the sole provider of, meaning that nobody else provides that service. So we do that annually for the La Plata County Commissioners. We ask the Archuleta County Commissioners if they have any specifics in their budget request. They have never given us any specifics, so we've taken it upon our own self to say, well, we'll give them the same information we give La Plata County. So the questions you have are in that proportional funding request. Because in the last two proportional funding requests, we've been working at a very fast pace, we weren't able to pull, we can pull restaurant inspections, we can pull septic inspections, we can pull NSP clients, we can pull WIC clients. We have had trouble pulling numbers of shots, which seems to be one that we are super curious about, and that's because SIS is the Colorado Immunization Information System. It is a very poor, it is very under infrastructured database that has a tremendous amount of demands on it right now, because SIS is being accessed everywhere in the state at once to put vaccine records in. So running reports out of SIS is just clumsy, and we can't get the reports, timely enough. It takes hours. And Susie, I'm sure you remember trying to run reports out of SIS. It was not an easy process. So we haven't parsed that one out, but we can, and we can ask staff to do it. It's just that our staff is running around extraordinarily busy right now doing this pandemic.
And Anne, I have a follow-up question to your meetings with the La Plata Commissioners. Is that something that they requested, and who meets with them from your department?
It is something that we offered as a staff. We've of course offered it to both sets of commissioners. La Plata County Commissioners has taken us up on it, and we meet with them with a variety of staff depending on what their curiosities and needs are of that time period. So it has been on the books at least since 2015. I'm usually present, and then if they have septic questions, then our environmental health director is present. If they have public health improvement plan questions, then Adrian's present. And if they have, how do we get the word out about never touch a bat, then our communications team is present. So we often ask them prior to, who would you like us to have this week?
And then you meet with them twice a year or once a year?
Twice a month.
Twice a month, wow.
Yes.
And how long are those
and
meetings?
We've asked to be on the agenda for discussion time in Archuleta County multiple times, and it has always been told to us it's not necessary.
How long are those meetings?
They usually run about 30 minutes.
Okay, I have one more, and then I'll be done. So, some members of the public one of my reasons for being here is that members of the public are interested in asking questions of San Juan Basin about numerous things, restaurants specifically, and at the meetings that you have every other month that you can zoom in on now, I guess, are you doing your meetings live now, or is it still a Zoom thing? Anyway, the public can only speak, they can't get any answers. How might we schedule San Juan Basin to be willing to meet with the public of Archuleta County and get their questions answered?
Well, I thought that's what we were doing today. In public meetings, the forum that we have is not that different than any other public meeting. If you go to the town or you go to a county, it's not that different. When you go to the public health meeting, there's a period for public comment, but it's not noticed, so there's not an engaged conversation during a public hearing or during a public meeting. There's an agenda item if you see it, but it's not an agenda item to have a discussion about things that aren't on the agenda that the rest of the public isn't noticed to have. So that's actually the norm for a board meeting. So people make a comment, but you don't engage in a conversation. For instance, my comments are about septic tanks, and then you don't answer questions there because it's not an agenda item. So that's that. But in terms of having a conversation between the public and public health, that big work session.
Right, and so, but prior to the pandemic, we've hosted 2, if not 3 open houses at our and actually one of them I distinctly remember was not in our Archuleta offices, it was in the Rosa Aragon Center. And so that was the 2017 celebration. But so what we do, and again, this is suspended during pandemic, but we host we don't do it every year, but every other year or so around public health week. What do they call it? I feel like there's another name for public health week. But we do it, so it's the first week in April, and we host an open house. And we have been, that's a regular practice. We do not do it every year. We had very, very limited participation. So we decided doing it every year would not be worth our while. Once the pandemic is over, I think it would be a great opportunity to do another open house.
So I guess to follow up with that, Leanne, how do you all take the feedback of the community and do something about it and report back to the community in terms of, I heard you, this is our response? So say you do have these open sessions, open houses, and people come and share their concerns. How's that feedback look like?
We do that, I think we do it informally every day when we receive phone calls and people ask, give the feedback to staff and programs and staff make adjustments. It's reflected in the description of services that when we describe many of our services show 30 to 35% utilization by Archuleta County residents versus La Plata County residents. I think it demonstrates a distribution of services across the counties, and people can call our offices and speak with the staff member in the program. The reason we do the open house is so that people can come in and meet the staff from each program and then open up their relationships to have an ongoing dialogue. And many of those questions come directly to me. And I've had countless discussions with individuals from Archuleta and La Plata County, especially over the last 20 months, asking about the public health response.
Did you want to say something to that about calling in and getting?
No, I don't think so.
Can we ask some
I
questions?
guess we need to wait a year or something before the public to be able to engage in a dialogue with San Juan Basin Public Health. Is that kind of?
No.
We gotta wait till April or what?
No, we're here to do. I think we'll have to discuss this at the next board meeting,
Okay.
how it is that we would certainly hearing it, absolutely.
Okay, perfect. And then how do you end the pandemic? How will we know the San Juan Basin has ended the pandemic? Okay.
I'm trying to balance that. I don't know if you guys can hear, but my dog is asking to be heard at the same moment. So I apologize that I checked out for a second because I'm trying to get him heard.
So she wanted to know, Leanne, how are you going to end the pandemic all by yourself?
Hey, we're trying as hard as we can. I have to say, we have incredible vaccine uptake in Archuleta County. That is certainly a huge step, following the precautions and limiting the spread of infection. but having an over 60% vaccination rate in Archuleta County is a wonderful step towards removing the threat of the pandemic to something that is endemic background infection that we can all move into steady state operations. Unfortunately, we're not there yet. Our schools are not in steady state operations. Many of our government services are not, and neither is the public health response. We're dealing with a once in 100-year event. It's not something we asked for. We are a million % sure it's not something any of you all have asked for. We know that this is tremendously difficult on all of us. We are just working through the steps so we can return to a recovery normalization period as best we can. And COVID continues to surprise and outfox all of the best plans that have been laid in pandemic response. We have been following the pandemic response model since we attended our first meeting in Pagosa in person the first week in March of 2020.
Can I ask one question? Wait, before we go to Susie Ann and then Lavonda, we only have 10 more minutes, so I have to give some time to some of our other members. And go ahead, please.
That's what I was gonna ask. I was gonna say, I know there's one person we haven't heard from, and I know two of us had a hard stop at 6, so I was just hoping we could be sure.
Thank you. So go ahead, Lavonda.
I believe you mentioned COVID, what was it, 25% outreach?
Yeah.
You said something like that. Can you explain what you meant by that exactly?
Like, what is
You
COVID
cut out a lot, and I'm sorry, I couldn't even, I'm not sure at all.
Yeah.
But
Could you repeat that question, please?
Do you know what I'm talking about?
Yes, I do. So Lavonda would like to know more detail about COVID outreach. Is it a
What
person?
exactly
Is it,
does that
what
mean or
exactly
entail?
What
is
does COVID outreach include?
Right,
services.
right.
Well, I'm gonna bring up a few things, because I've been involved in them on 2 angles, but one of the most significant things I think that happens is there are a lot of meetings that are coordinated through public health in which public health leads and attends. One is an executive meeting every, at least once a week. It started out 3 times a week, then it went to 2 times a week, in which leaders from kind of core groups attend, town leaders, county leaders, hospital leaders from both counties, school district leaders from Bayfield, Durango, here, Pagosa. So that is a group that's coordinated. There's a specific school group that is coordinated, and it is a weekly meeting that is discussed. And Leanne, you can jump in with things I might be leaving out. Then in terms of on-the-ground outreach, I talked about the sorts of things that have been available. The receipt of vaccine has all been handled for both communities, has been handled through San Juan Basin Health, ordered through public health. It goes into a hospital in Plata County for purposes of being held in a safe location. Then San Juan Basin Health people help get it out to the hospitals in order to deliver the vaccine. There are most of the testing that is being done for travel, because nobody has enough staff anymore to be able to take people in and test people that are asymptomatic. Most of the asymptomatic testing is being done by public health. Those are things that come readily to my mind, for which I know Archuleta County has greatly benefited. But Leanne, you can jump in for what I'm leaving out.
Oh, I think you got everything. I mean, I'm sure there's more, but public health outreach is an ongoing. We have a significant team working on communicable disease prevention, investigation, and control, so that we can contain the spread of infection in our communities. And so that is how the team works. At earlier junctions, we had prevention, investigation, control, as well as mitigation. and mitigation are the large-scale efforts to stem spread of infection in public indoor spaces and in requirements in schools. We have a team working on that as well.
So is your outreach is including education? Does your outreach include being present with resources at a site? And your outreach basically includes responding to populations that may, she's just trying to ask, what specifically does your outreach include? Education?
Education about how the virus is spread.
Okay.
So how to protect yourself and keep yourself safe from something that's spread through droplets or something that's spread through aerosolization. Then what symptoms to look for
So that's
when you might
education.
need a test, right? Okay, so education.
What else?
Then what symptoms to look for, when you should get tested, what you should do if you learn that you're exposed, how you should communicate to others if you have been exposed or you've tested positive. So this is work that our team does on one-on-one basis with individuals, as well as in a variety of community presentations, as well as with workplaces, businesses, and organized events. Then we also do what are best practices if something is spread through droplets or aerosolizations to prevent spread in a certain type of environment. So we will coach any business, workplace, or organized event on what is a best practice to mitigate spread of infection. We also work to have testing available. Our team is working troubleshooting to make sure, I don't know if people have tracked this well, but a lot of the testing has changed over the course of the pandemic to what types of tests are available, what the return time on those testing results are, and how that test is, how that test result is found. Is it a molecular test or is it an antigen test? So our team works to make sure that that information is available and understood. Then we work through quarantine and isolation. If you test positive, what are your needs? So if someone were to test positive for an infection and was asked to not spread that infection to others, they may have trouble going to work, getting groceries, paying your bills, have trouble with childcare, trouble not spreading it to other members of the household. So our team troubleshoots with every individual who's asked to isolate or quarantine to say, are there missing needs that you have to be successful? And then we, if it's something that we can solve, if somebody says, yes, this is my need, and it's, I was planning on going to my, daughter's wedding or something, we're not gonna be able to fix that, right? But if it's something like, I can't pay, our rent, then our team works through how do we go through community resources to make sure at the end of their quarantine or isolation period that they were successful without spreading infection onto others. Coaching on if your symptoms start to change, when should you seek medical care? So I hope I'm answering the question to some degree, but that's what we do on the individual basis, and then that's what we do at multiple community meetings. So we meet with the Pagosa Economic Recovery, we meet with the Pagosa Chamber, we do some of the meetings we do. Here's when we're meeting with all the Pagosa teams, and here's when we're meeting with all the La Plata teams, and then other meetings we do everyone together on the stakeholder call or the policy call, because we don't want to go through the information twice. And that's things like, hospitalizations are up in the region. We currently right now in Southwest Colorado, we have 96% utilization of ICU beds. This is something we're highly concerned about. If, someone were driving home from this meeting tonight and got into a car wreck and needed care, you would have to be sent out of the community because we're 96% full in our ICU. So we're constantly providing that type of situational awareness to all of the community partners so that people can act accordingly. When we provide this information to government partners, they will make decisions to say all of our board meetings are now on Zoom because of this, information that you've provided and the public health advisory you're putting in place. So that's the ongoing type of communication. That's an example, but that's what the aim of providing a regular cadence of updates of information in COVID is. And unfortunately, this takes a tremendous effort, which has, quite frankly, gotten in front of some of the steady state programs that you all are very, very, and rightfully so, interested in. We are very much looking forward to having the bandwidth to put all of this attention into our steady state programs. But when we're still facing things like one ICU bed across 5 counties in Southwest Colorado open right now, and that's been the case for over a week, we still have to put our efforts into mitigating spread of disease.
So that includes immune health, education, right? Okay.
Yes. Yeah.
Leanne, thank you so much for all of that. I have to go, and but I want to say this has been, to me, incredibly enlightening and engaging and informational, and I would like to do this again, and I credit you all as being the catalyst for this. I apologize if our letter back was vague and not committing enough. I think there was some miscommunication on all parts, but I feel like the real issue is what is best for the citizens of Archuleta County, and how can we best convey what is here, what is offered, what is available, and how best. And if we are not doing it the best, then let's look and see what the options are. But I would love to do this again, and you know, as annoying as Zoom is, it actually does, yeah, it facilitates, it brings people together, and you know, I think this is what our community needs terribly. So thank you all.
Thank you. Thank you, and thanks to all of you who joined us via Zoom, appreciate it. Thank you. And Leanne and your staff and the 2 board members from the health.
I'd like to do it again. I'd like to do it again.
And our committee.
Well said, Karen. I thank everyone very much, and including also all the people that are attending and providing their time to take in information.
Yes.
So on that note, we'll adjourn the meeting. Thank you so much for being here again, and we hope this is the beginning of our continued conversation.
Thank you.
It's like all the questions were soft.
Can I ask you guys a question before you depart, since you are representing?
We're basically finished now.
Yeah, I know you're done with
let's
them,
just make sure, because the meeting is ended.
But I know, but just for you guys as individuals. Can I ask you a quick question before you go? Because you are supposed to be representing us.
I will say the questions were soft. I'm leaving.
Okay, I just have a quick question. So there's 3 deaths in this county, right? There's 14,000 people. If you look at that percentage, right, that's 0.02% death rate. Now, I have worked in an emergency room under the famous Dr. Peter Hackett and the Institute for High Altitude Medicine. So you cannot reject the null hypotheses even close with those kind of percentages. So I'm just curious, what statistical significance can you bring to me to show me any reference to COVID-19 whatsoever? Any allocation of resources, anything? Can anyone do the math? Am I missing something? It's pretty basic math. Can anyone show me their math that they're doing? Because are we basing this on science, or are we basing this on headlines, imagination, and complete fantasy? It's pretty simple mathematics. I'd be happy to sit down and do it with you guys. But I'm asking you to ask her next time because they don't respond.
Can you
No.
go away?
Yeah, see, this is the kind of response we get from this garbage department that's
But
supposed
that
to, it's
was
insulting to the
that was
working
just
class
an
people that actually do things for the community.
Actually, I think that was just probably.
Maybe, but I have reached out to them before with no response.
Same.
And this is insulting to the working class people of this community, that they just disperse these funds in this bureaucratic mess. And as you saw, there's not a single freaking thing there's no rubber meets the road here.
And as a programmer and a data analyst for
And I'm
years,
speaking for a lot
4
of
years,
big
you can
demographic
separate data
communities.
very
This is
easily.
garbage.
Just get the right people.
Can I just address something, sir?
Please.
One of my purposes for being being here is to open up the communication between that
Yeah.
agency and understand.
I know, I'm not attacking you guys as individuals, I'm
I just
attacking
want
her.
to tell you, we are trying to work on that, and it may be that
Well, show me
if
the
they can't
map.
cooperate, then they're the wrong ones to provide.
They are the
service.
wrong
I mean,
ones.
I don't
Ask
know.
them to show you the map that would suggest statistical significance. This is a clinical standard. It has been for decades. 5% to reject the null hypothesis, okay? I know she has an art degree, so maybe she doesn't know that, but for someone in that position, they should know that. This
And
is-
for all these questions, the website itself could house all of these on their website. They've done a complete redesign,
There
but there's
is-
nothing in there. Yeah.
Show us something quantifiable so they can be held accountable, because this is all.
We appreciate everything you guys have done. It's just, we're just,
That we're asking, so give us some time, we're open.
Nobody asked the
You don't
questions
need
I asked
time
just
to
now.
ask just to
We
show
are
the
asking
numbers.
Questions and we're working with the county commissioners about those
Okay.
very questions. Because
We're running out of time. This is destroying our culture, our community, several people's livelihood as they sit back and get their government funding. Federal funding, our funding, right? We're paying for what? And I'm sorry, I'm irritated, but you know, like you guys have found yourself in this position and you're gonna get the brunt of this. Great job, though.
Yes,
You did
all
a
you guys
nice,
did great.
you tried to hold them accountable, but do you see how they never even answered your question?
The first question, the first answer she gave was like 45 minutes of non-issue. It was very annoying.
These people
And I
are
think she did that to
trash.
buy time.
Let me just say, I understand, I'm like you, but these guys, at least there is a committee, and they're trying to
I know.
get, they didn't get very far, but at least.
Yeah.
You guys did way better than we would
I'm projecting on you guys, but I've tried to reach out to them with no response whatsoever.
It's hard
So
to-
I don't know what they're getting
Go off
paid
the deep
for.
end, I get it.
This is extortion at best, and really what it is just criminal activity. This is garbage. Can any of you guys show me statistical significance for COVID-19? I mean, I have worked in an emergency room. I'm not insane, so maybe my math is wrong, but they don't want to ever give any numbers, do they? They like to do percentages, but they don't want to do quantifiable numbers because now they're accountable. But you'll never see that from them, so thank you though for what you're doing. Sorry for, projecting.
We would
my
be horrible
displeasure
in the
on you.
meeting. We would. We know that.
Yeah, thank you guys, keep it up. Maybe we'll get a little farther, deeper into
I
it.
have more questions too that I wanted to get into some deep stuff.
All I can say is, this is better than what it was.
Yeah.
You know, that they even wanted to speak with you, because they could have said no, right? They could
They
have
haven't
said.
said no, now they say yes.
I
And all of a sudden, oh, we're here.
Yeah, I know, so we got that on tape.
But you know what it
Let's do
took us to get them over here?
That's what,
Well,
we-
I agree.
I know, that's what would be the next thing.
So it's a beginning.
I know, it is a beginning, and I understand where he's coming from.
Yeah.
I'm gonna express it too.
Yeah.
He just had to release that, and he was cool, he didn't throw it in. So I waited until they were gone, which I think was good.
You guys, have a good night. Take care. Thank you.